Welcome back. So today I'm going to talk about a topic called hypertension in pregnancy as well as preeclampsia. And this topic, why I decided to do it is because upon a request of one of you, and thank you for your request. And anyone who have any questions you want me to talk about, please put it in this comment section again. So I will go through your request, and I will go through and I'll put it in the KIV list, and then we will slowly use up the topics that have been suggested by some of you over the next few weeks or the next few months. Okay? Alright, so this topic, why is it so important? Because preeclampsia is something, number one, is life-threatening. Number two, is totally preventable. You see, it's life-threatening and yet it's preventable, and yet people are getting it. So sad, right? Because we already know that it is preventable. We already know how to prevent preeclampsia for so many years already. I think it's already been more than 10 years by now. More than 10 years, we already know how to prevent preeclampsia, but we are still seeing preeclampsias. And what happens when you have preeclampsia? The problem is life-threatening to both mother, baby, ICU admission for mother, for baby. And now, you know, with COVID, we don't have enough ICU beds. Let's not burden the ICU beds with so many preeclampsia. So actually, preeclampsia can be prevented, but unfortunately, nobody is preventing it. Nobody is doing anything to prevent it. Recent years, I see a bit of changes. I also don't totally blame whatever the thing that's going around now. It's because of the system. Because why? In order to prevent preeclampsia, the prevention must start less than 16 weeks. If possible, even less than 14 weeks. And that is the problem. Why is that the problem? Because many mothers in Malaysia don't go and see a gynae before 14 weeks. You may see a GP, do a pregnancy test, and then if pregnancy test say you are pregnant, then you just tell yourself, it's okay, I just take a bit of folic acid. Later when I'm free, maybe when tummy bigger first, then I go to clinic kesihatan. Maybe I go clinic kesihatan at 4 months, 5 months, or maybe I start seeing gynae later. There are a lot of mothers in Malaysia also, they will see the GPs first. No, they test positive and then they follow up with the GP. They follow up with the GP, follow up with the GP. Then somewhere around 7 months, why the keyword 7 months? 7 months only you go and see gynae. Too late already, you cannot prevent preeclampsia already. Why 7 months you see gynae? Because 7 months onwards, GL cover. Oh my God. So because GL cover only from 7 months onwards, so 7 months onwards only you see gynae, too late already lor. So before that you only see GP, but GP didn't prevent you from the preeclampsia. So how? Even in government also, we see a lot of mothers only go to clinic kesihatan after 4 months. You know, there's this mentality, clinic kesihatan, no, you go so early. Go after 4 months. So go after 4 months means after your 14 weeks already. So you cannot prevent preeclampsia anymore after 14 weeks. So that is the problem. That's why we still have a lot of preeclampsia in Malaysia. A lot. We still see it every now and then. A lot of people still do not know that they can prevent it. They don't even know that they are going to get it. Okay? So you see, what is this preeclampsia in the first place? Why are we so worried? Preeclampsia is part and parcel of this hypertension in pregnancy. We say hypertension in pregnancy is like a complex, there are many variety. Some people just get a bit of hypertension and that's it. And all this actually we are not worried. But once you have preeclampsia, which means that other than the high blood pressure, now you have protein in your urine. Now you know why every time you go and see your gynae or go to clinic for your antenatal checkup, we will definitely do the urine test, right? We do the urine test to detect protein in your urine. And once you have protein in your urine, that is when we start to worry you have preeclampsia. And why we worry about preeclampsia is because when preeclampsia come in, your blood pressure can shoot sky high, you know, sky high, and then there's nothing we can do to control. All the anti-hypertensive medication to control blood pressure cannot bring your blood pressure down. Your blood pressure is sky high, and when it's sky high, it can cause stroke. So preeclampsia can cause stroke to the mother, which end up you will be bedridden for the rest of your life, which is something we do not want to happen. And you can also die because of the stroke. So just like any other people who get stroke, old people get stroke, they become bedridden. Old people get stroke, they die. So can happen to pregnant women as well. And other than that, it can also cause heart failure, it can cause kidney failure, it can cause liver failure, and all this fail can also die. So it's life-threatening to the mother. That is why mothers do get themselves in ICU because of preeclampsia. You can either end up in ICU or HDU, which is, it means that you are in a life-threatening situation. And as I say, in this pandemic, we do not want you to go to ICU because ICU is precious. ICU is precious for COVID-19. So if you are going to use up, then we have not enough ICU beds, okay? So as it is, we don't always have enough, ICU beds as far as government hospitals are concerned. We never always have enough. Sometimes we also don't have enough. Without COVID-19, we don't even have enough ICU beds to use for all the government patients. Now with COVID-19, I believe it's worse. So we do not want pregnant women to go ICU. So we must make sure you prevent preeclampsia if you are pregnant, okay? So the first thing is we know it is life-threatening to the mother. So that's why we need to prevent. Next, we also know it can be life-threatening to baby. Why? Because preeclampsia can cause, what does it cause? It can cause IUGR, which means that baby become very small, cannot grow. It will cause the water to reduce, which means you have oligohydramnios, means there's no more water surrounding the baby. So when the water level come down, baby stop growing, baby can also be deprived of oxygen and as a result can also die. So you see, mother can die, baby can die. We don't want that to happen. And very often, we are also forced to deliver early because we see, oh, mother life-threatening. Oh, baby life-threatening. So we need to deliver the baby earlier. And then when we deliver baby earlier, baby also in ICU. Then you have mother in ICU, baby in ICU. So most of the time, when you have one mother and one baby in ICU, it's very often due to preeclampsia. And see, if we prevent preeclampsia, we save 2 ICU beds, not 1, 2. So we need to find ways to prevent. And because of that, because we know we need to find ways to prevent, medical doctors have already done so many research and we already know how to prevent. We already know how to prevent for more than 10 years already. I think it's like almost 20 years already. We know how to prevent preeclampsia. We already know. But then there is also a challenge. There is a challenge. We know how to prevent preeclampsia, but we don't know who is going to get preeclampsia, right? Am I going to start treatment for every mother? Because we know, number one, to prevent preeclampsia, you need to start treatment before 14 weeks. Means you need to start treatment early in the pregnancy. It won't work if you start treatment at 18 or 20 weeks. It won't work anymore. It only works if you start treatment early in the pregnancy. Then, how? We give all the mothers treatment. Also doesn't make sense, right? Because the number of mothers going to get maybe only 1 or 2%, but we're going to give everybody medicine. Also doesn't make sense. So, how? We know how to prevent, but we don't know who to give. So initially, during the early years, like 15, 20 years ago, we usually give medication only to mothers who already have preeclampsia. Like your first baby, preeclampsia. So I know already your first baby got preeclampsia. High chance you get preeclampsia again. So this time, I'm going to start you on treatment. And we have done that so many times. And we have seen so many mothers. First time preeclampsia in ICU, baby in ICU. Second time we start treatment, no more preeclampsia. Third pregnancy, start treatment, no more preeclampsia. Fourth pregnancy, start treatment, no more preeclampsia. So it's actually preventable. So, but that is not enough. We still need to have one time before I know you are going to have preeclampsia. Can I totally prevent all the preeclampsia? Then we start to do more and more research. And finally, we found out that it's actually possible. It's actually possible. So now what we do is we look at risk. We look at risk. There are many ways to do it. One way is we look at risk factors. If you have a risk factor for preeclampsia, I'm going to start you on treatment so that I prevent the preeclampsia. That is one way. But this way also, it is a blanket rule. Like for example, 35 years and above, your age is too high. We want to prevent you from preeclampsia. Any first-time pregnancy above 35 years old, take this medication. But at the end, we also know, maybe out of these 100 people that take this medication, I probably only have 4 or 5 preeclampsia. So another 90 over take medication, but actually, even if you don't take, you won't have preeclampsia 1. But using this risk factor is in a way will reduce, but not truly lah. Why? Because there's still a lot of preeclampsia who get it when they are younger, before 35 years old. So even when we look at risk factors like, your blood pressure is a bit high already right from the beginning of pregnancy, you are a bit overweight, your age is a bit high, you have family history of high blood pressure. So these are the risk factors. What we can do is you can look at that. And this is very commonly practiced nowadays, I notice, in the government clinic kesihatan. But it is commonly practiced, but it's still a bit over treatment because you end up treating a lot of people, but you actually prevent very few. So I treat 100 people to prevent 5 or 6 preeclampsia. So it's again a bit over treat. So there's another way is a test. There is actually pre-eclampsia screening test. Pre-eclampsia screening test consists of 3 components. 3 components. First, I need to key in your age as one of the factor. And number 2, I also want to look at not just the age, the weight. And number 2, I want to look at your blood pressure now. So when we do pre-eclampsia screening, we check blood pressure both right hand and left hand because there's slight difference. This pre-eclampsia screening that we do, 3 components. So first component is your age and also your weight. Number 2 component is we measure your blood pressure right and left. And third component, we actually do an ultrasound scan and we measure the pressure of the blood vessel that go to your uterus. So when I measure the pressure of your blood pressure that goes to the uterus, then we have all the readings. All these are numbers, right? Your age is a number, your blood pressure is a number, your weight is a number, and the ultrasound or pressure of your blood vessel is also a number. And last of all is actually the blood test. Blood test, again, we measure certain things. So actually the 3 components is mother's risk factors, which is the age, your weight, your blood pressure. Second is ultrasound scan to measure the blood pressure of the blood vessel going to the uterus. And third is the blood test. I do a blood test for you to screen. And guess what? It is the same blood test that we do for Down syndrome screening. So when I do a Down syndrome screening, I can just add on pre-eclampsia screening together. Both add on, and the lab usually, because they're doing the same thing, they add a bit only, not much. They just add a little bit and then they will do everything. So if you do it separately, it's a lot more expensive, but you do it together, it's actually very cheap because they just add a little bit because the test is the same for both Down syndrome screening and pre-eclampsia screening. So when you add both together, you can do together at the same time. So when you do you will realize Down syndrome screening and pre-eclampsia screening is more or less the same. So because when you do this test, the timing is the same. It's usually between 11 to 13 weeks. The key, 11 to 13 weeks. Why? Because you need to start treatment before 16 weeks. Ideally before 16 weeks, if possible before 14 weeks. So if I do your blood test between 11 to 13 weeks, it's just the right time. Perfect. You do the blood test at that period, and in both these blood tests, we also look at your age. So, but in pre-eclampsia screening, we need to look at your blood pressure and your weight to look at other risk factors for pre-eclampsia, and then we will also measure your blood pressure left and right, and we will do the ultrasound scan. And when we do ultrasound scan we just do together For Down syndrome, we may look at the nasal bone, we look at the anti-measurement of the back of the neck. So for pre-eclampsia screening, we go and measure the blood vessels that goes to the uterus, and we measure the pressure of the blood vessels that go to the uterus. And then last of all, we take the blood test and we test the same thing for both. So you save a lot of money because the lab charges will be reduced because it tests the same thing. And just by doing that, you know whether you're going to get preeclampsia. So by right, all mothers pregnant should do this test at 11 to 13 weeks so that you know whether you're going to get preeclampsia or not. Because if you know you're going to get preeclampsia, then you need to start treatment. And if you start treatment, you won't get preeclampsia, you won't go to ICU, baby won't go to ICU. Okay? Then we save 2 ICU beds. So that is the problem with preeclampsia. Preeclampsia, remember, is life-threatening. It's life-threatening and you need to use two ICU beds. And why is it connected to premature birth? Because last week I was talking about premature birth. Premature birth, there are 2 types. One is natural one, it comes on its own. The other one is man-made one. Man-made means I'm forced to give birth. I'm forced to make sure you give birth. Because life-threatening ma. Either the baby may die soon or the mother may die soon. Nobody wants to die, right? So I'm forced to give birth. As far as the mother is concerned, once the baby is out, blood pressure comes down. Magic, you know, it's like magic. Your blood pressure is sky high. I take out the baby. Tomorrow, your blood pressure is normal. Magic. But baby suffers at the end because baby usually premature. And when baby premature, you'll be ICU, not just for 1 day, 2 days, maybe 1 month, 2 weeks, 1 month, or even more than that. So that is why we need to make sure we prevent preeclampsia. So this is the scenario. We know preeclampsia exists. We know preeclampsia exists for centuries because mothers and babies have been dying of preeclampsia. So as a result, we already found the treatment to prevent preeclampsia, which is also very easy to prevent. Just some tablets you just take from early pregnancy until the end. Simple. But after that, when we found the treatment, we don't know who to give. And now we already know who to give. But we have another challenge. Not everybody is getting the test done. Not everybody is getting the test done because of various reasons. Reason number 1, many mothers go and see gynae late. You see gynae late. You see GP first. You come and see gynae late. So that's why we cannot do the test. Some of the places that you go may not be able to do this test. Taking the blood is easy. Measuring your blood pressure is easy. I know your age, I know your weight. What is difficult is still the ultrasound scan. The ultrasound scan, to be able to do this ultrasound scan, that particular doctor need to be trained to do it. So they have to go for a special course. It's not difficult but you need to go for the course. I would like to say it's not difficult, but I also would like to say it's also not easy. Because I remember I had to go for the course 2 times. I went for the first course. I can't remember where I went. I went for the first round for the course. And then I tried to do, but I wasn't very sure. And then after that, I have to register for a second course. And I still remember this course was in Hong Kong when I went. And then it was a lot more clearer. So I also had to go for course twice to be able to really get the accurate measurement of this pressure of the blood vessel. Because it's not easy to find the blood vessel. If you measure the wrong blood vessel, then it becomes the test is not accurate anymore. So we must know which blood vessel to test and we must know how to do it. So this particular ultrasound scan need a bit of skill, need a bit of training, but trust me, it's not difficult lah. You just need to learn. You just need to learn. You know, if you have a course and you teach someone to do it, you just have like 10 mothers in front of you and just practice. It's so easy what? Any pregnant mother, you just put your ultrasound scan there and practice. And then you'll be able to get it done. It's not actually difficult to do this test, but unfortunately, it is not easily available because I have not seen anybody teaching anyone in Malaysia to do it lah. But anyway, this test is not new. It has been available for quite some time. You just need to learn how to do the test. And because of all these things, this test is still not easily available. And that is why now in government hospital, in clinic kesihatan, they are not doing this test, but only they are doing for risk factors. So they look at risk factors, they start you on treatment. To me, that is already an improvement. Because if talk about 5 years ago, they don't even do that. 5 years ago, nobody gets aspirin, whatever it is. They don't get treatment for this preeclampsia. Nobody gets it. Recent 5 years, I've been seeing a lot of mothers being placed on this treatment by clinic kesihatan based on risk factors. They look at your age, they look at your blood pressure, your family history, your weight, and then they start you on the treatment already. but that is not so accurate because we are a bit over-treating. In order to be more accurate, you should do a pre-eclampsia screening test. Pre-eclampsia screening test, the only problem is not many people are trained to do it in this country, but it is available. But in order to get it done, you must, number one, visit the gynae early, and number two, get this test done. So you have to ask your gynae way before that. Don't wait until 11 weeks. Because 11 weeks, you need to do it already. So you need to go to a gynae very early, like 7-8 weeks, you really go and see a gynae and ask your gynae whether you do the pre-eclampsia screening test. Because you know about this pre-eclampsia screening test, whether your gynae do it or not. If not, then go and look for it elsewhere and make an appointment to get it done. So we do it in our clinic, we offer everyone. In my clinic, I offer everyone pre-eclampsia screening test. I don't say it's a must to do it, because it costs a couple of $100, not many people are willing to pay, but we offer it to everyone. And actually the pickup is quite good. 30 to 40% of my mothers will actually do the test. So when you do a pre-eclampsia screening test, that is the only way I can detect whether you are at high risk of pre-eclampsia or not. And once I detect, then I will start you on treatment. And once I start you on treatment, then you won't get pre-eclampsia and you won't have any of these life-threatening scenarios, and you can save 2 ICU beds for the Malaysian government, okay? So you need to save ICU bed because ICU beds now are very, very precious. Okay, so, and we don't expect the pandemic to go away so soon. We should be prepared to face this third wave, fourth wave, fifth wave over the next 1 year. So we need to learn how to save our ICU beds. So we need to prevent mothers from going to ICU, babies from going to ICU, so that we have more ICU beds left for other people. Okay? So, yes. So that's all for my talk today. So now I'm going to go and look at the questions that you have. So any of you have any questions, please post it up in the comment section. And thank you once again. If you have missed any of the topics before this, we have 20 to 30 topics now, all in my YouTube channel. So you click to the link in this post. Just click into the link, you'll go to my YouTube channel. Please remember, to subscribe to my YouTube channel. Please like my videos and also press the notification button so that you will be notified for any new videos in the future. We actually have a very big bank of videos there. Some are pre-recorded, some are live videos. All the live videos are there, and we also have some pre-recorded videos there. So go to my YouTube channel, Please subscribe to my YouTube channel to get all the latest updates on women's health. And news to come in the future, we may be adding pediatric topics as well. You know, most of you who know me, you know that my husband is a pediatrician. Okay, I have, managed to get him to come up, to get involved in all these programs, but he is a bit shy, he doesn't want to do live, so it's okay, we will probably be doing pre-recorded things, and we will put it all in the YouTube channel, So we will have both gynae and peds later in this YouTube channel, so please subscribe to my YouTube channel so that you will get all the notification on all the latest videos and the upcoming videos that will be coming soon, okay? So this is for today. Any question, please put it up. And for any of you who have anything you want me to talk about, please just suggest it in the comment section. I'll put it in my KIV list, and I will go through the KIV list every time to see what topics are there to present for the next week. Even today's topic, thanks to one of you who suggested it. So most of the topics from now onwards will be solely based on your requests, because I more or less already talk about a lot of topics already. I'm running out of topics, so now I let you decide what you want me to talk about, okay? So put it in the comment section. So your support will help me go on with more live videos, alright? Okay, what causes preeclampsia? Vivian Ko asked. I think we always say that, I still remember when I was a medical student, my lecturer used to tell me there's actually a Nobel Prize there waiting for anyone who can discover preeclampsia. So we don't actually know the exact cause of preeclampsia. But one thing we know about preeclampsia, we think it's something got to do with the placenta. And that is why we need to start treatment early. Because you must understand, every pregnant woman has 2 placenta. The first placenta that form during the first 3 months, that one is not the established one. It's not the mature placenta. It's just a temporary placenta. So that's why people always say we are not stable, not stable, not stable. Because during the first 3 months, it is actually more likely to bleed and things like that, because the placenta is still not holding very well to the uterus, because it is still new. And it has not grown a lot of its, it has roots. Actually, placenta have a lot of roots. You see, the roots grow into the uterus and hold it there. So this mature placenta only comes in after the 4th month. And as a result, this is the placenta that causes problems. Something happened to this placenta that caused the body to secrete from the placenta. Actually, the placenta secretes certain chemicals that cause the blood pressure to go up. So you see, it's the placenta that secretes these chemicals that cause the blood pressure to go up. So one of the reasons why it happened, we think maybe it's due to the blood supply to the uterus not so good. So you see, that's why we measure the blood pressure of the blood vessel that goes into the uterus. Some people, their blood pressure here is normal, but the blood pressure in that particular blood vessel that goes to the uterus may be not so good, which means that the amount of blood that's going in is not so good. And if your uterus already know that I'm not getting enough blood, then I must send in all these things to send to the body, to ask the body to raise the blood pressure so that the blood can go to the uterus. So these are the things that that we think lah. This is what we think. But the true cause of preeclampsia still got Nobel Prize. Unfortunately, I'm not a researcher, so I don't think I'm going for that Nobel Prize. Okay. So Nur Hayati, this topic totally related to my first baby, preeclampsia, born 32 weeks, second baby, preeclampsia, 28 weeks. I didn't get prescribed any medication for my second pregnancy, even though I had the firstborn with preeclampsia. Thank you, doctor. You're most welcome. So good that you know. So if you want to get pregnant, it's very easy. I have many mothers already in my hand that if I have the first preeclampsia, what I did was I just give them the medication in early pregnancy. But be very, you need to understand that you need to see the doctor early, and that is the key point. Okay? The key is you need to see the doctor early because the test need to be done before 11 weeks. Which she asked, any treatment other than aspirin for preeclampsia is aspirin plus high dose calcium. So it's not just aspirin. So it's aspirin plus high dose calcium. But aspirin is a must. There's no alternative. Yeah. No Najiha asked, if doctor prescribed medication for my next pregnancy from early, how many percentage that I will not go through severe preeclampsia again? Okay, the percentage of not going through is more than 90%. It's more than 90% you won't get it already. Yes, some of you will still get it lah. I agree with that. But the percentage is very low already. Because I've seen many very bad preeclampsia cases as well, that if despite, after giving aspirin, I don't see the preeclampsia happening anymore. But I also agree there are 1 or 2 cases. Because I have been giving preeclampsia for those with previous preeclampsia for like 10-20 years by now. So I actually have a lot of mothers that I have been giving medication if they had preeclampsia in their first pregnancy. And most of them we can prevent. More than 90% will be prevented already. Okay? But ideally, it should be preeclampsia plus high dose calcium. Actually, kind of pity you all want, you have so many tablets to take. High dose calcium is a lot of tablets to swallow. But I notice sometimes people only get aspirin and not the high dose preeclampsia. Anis asks, hi doctor, recently I've been diagnosed with preeclampsia at 36 weeks for the first time in my life. Is it possible for me to successfully deliver? There is nothing to say that preeclampsia cannot have a VBAC, cannot have a natural birth. But to have a natural birth with preeclampsia, you need to deliver earlier. You need to deliver earlier, which means that you need an induction. And the question is, can you induce? Someone who have 2 previous caesar can be a difficult thing to do. So my answer to you is most likely no if you have 2 Caesars. If you have 1 Caesar, or if it's your first time, you have no Caesars before, definitely can we just induce you earlier. To me, for preeclampsia, induce earlier, don't wait last minute. So that's the problem. A lot of time we try to hang on, and that is why you have 2 persons in ICU instead of 1. So sometimes you deliver earlier, we have 1 in ICU, not the other one. Sometimes you think you want to hang on, but at the end of the day, it may not work. It's always better to deliver earlier. As far as I'm concerned, preeclampsia, I always deliver early. I try to deliver early. I don't want to take the risk. Just deliver them early before it becomes too life-threatening. Shukriya asks, has it got to do with spotting in early pregnancy? No. How does doctor determine when to give birth whenever the mother has high blood pressure? As I say, every doctor has a different threshold. First, we look at how many weeks lah. Of course, we want to hold it as long as possible, but we try not to reach preeclampsia, because preeclampsia, you have hypertension, you have preeclampsia, you have severe preeclampsia. It's a severe preeclampsia that makes you life-threatening. It's a severe preeclampsia that can end up mother in ICU. It's a severe preeclampsia that the baby can also die. It's a severe preeclampsia that most likely will end up with a caesarean section. So for me, I tend to go all out for natural birth. So I don't want to get caught and being forced to do a Caesar for you, and some more ICU, and then almost life-threatening. So I try to deliver earlier. That is my way of practice, except for some cases where the preeclampsia can start at a very, very extreme early stage. So we try to deliver earlier. But if let's say you are not too bad one, that means you are either just hypertension or mild preeclampsia, then you ask me 36 weeks is the best time to give birth. 36 weeks, no point waiting already. Understand? Really no point waiting. Because you wait, you are only waiting for the severe preeclampsia to come. If first baby no preeclampsia, does it mean that we are free from preeclampsia? No, not 100%, because we know age factor. Age factor is also a risk of preeclampsia. The more babies you have, like the 5th baby and above, also high risk of preeclampsia. So not necessary. And there's something interesting with preeclampsia. We say that if you have a new husband, your risk is renewed. So we always know that first pregnancy is as high risk because we do not know who. Then if you didn't have, then you are less likely to have in your subsequent pregnancy, but it's not say won't, because of age factor you can still have. But if you marry a new husband, you're considered same risk as the first pregnancy. So very interesting to have this observation that we notice among doctors, and it's all published in all research, and we knew like a century ago, but we cannot find a reason why. So I told you there's still a Nobel Prize there for preeclampsia, okay? Hi, Dr. Tan. Darren asks, how does doctor determine when to give birth? Mother who has issued with high blood pressure control medicine, under what circumstances we should tell doctor to deliver baby? You don't tell doctor when to deliver baby. Doctor decide for you, yeah? So, but this is a matter of opinion. Some people deliver 36, some people deliver 38, but I believe nobody will go after 38 weeks if you are already on medication. You have high blood pressure on medication, you don't have preeclampsia, the latest we wait is 38 weeks. But if you have preeclampsia, then normally nobody will wait 38 weeks. And also depends on when your high blood pressure came. If your high blood pressure only started towards the end of pregnancy, we are more scared. Compared to high blood pressure that start from the beginning of pregnancy, or you have high blood pressure before pregnancy, we are not so scared. So we may wait until you're 38 weeks. But if your high blood pressure only started towards the end of pregnancy, these are the mothers that are more likely to develop preeclampsia and severe preeclampsia. So we usually will deliver earlier, and 36 weeks is the norm. Sujin asks, hi doctor, I wonder is it possible to get PE on the 40th week? Of course you can get PE at the 40th week. You can get preeclampsia at the 40th week. You can get preeclampsia after 40 weeks. You can also get preeclampsia after you give birth. You can also get preeclampsia only on the day you give birth. So it can happen anyway. But the after give birth one is a bit rare, because typical preeclampsia is that high blood pressure, baby come out, the blood pressure drop down. But in very rare and interesting cases, they get preeclampsia after they give birth. So you see, that's why we don't really know why preeclampsia come. Nobel Prize is there. So Darren asks, but early delivery will expose baby to further risks, right? 36 is not risky for baby anymore. So we have to weigh the risk and the balance. 36-week baby most likely will not enter in ICU anymore. But if I hang on anymore, maybe the mother will end up in ICU. So you see, we have to, because of that, that's why we look at the risk. There is no fixed rule, we look at the risk. But I tend to prefer to deliver earlier is because if possible, I don't want anybody in ICU. You must understand, we are private sector, we are not government doctors. Government doctors can hold on. Worst case, ICU. Hopefully you have an ICU bed. But private doctors, we try not to go into ICU because ICU will cause a bomb. So that's why sometimes I prefer to deliver earlier. If you have 36 weeks, I will deliver you 36 weeks if I think you are at risk. Because 36 weeks, baby less likely to be in ICU, but mother don't need to be in ICU. Deliver everything normally. So why want to take the risk and end up in ICU? ICU is not just about the cost, the worry, the risk. It's not worth it. Is it possible? Darren has a lot of questions though. Is it possible to have natural birth after eclampsia and C-section done? Or you mean next pregnancy? Oh yes, definitely possible. Definitely possible. There's no reason why you cannot have a natural birth in your next pregnancy. Just make sure you don't have another eclampsia and don't have another C-section. Another pre-eclampsia. Try and avoid that. We don't have to have C-section. Eclampsia, you need to have C-section. For those of you who don't understand what is eclampsia, eclampsia is when they already have full-blown, they have fits as a result of the high blood pressure. So which means there's some amount of brain damage already at that point. So that's why they need to have an immediate delivery, and usually it is always a C-section. And that is really life-threatening. So at that type of situation, ICU is a must already. So when you have such a situation, definitely you need a C-section at that time. But the next pregnancy, if you can start treatment early, prevent the eclampsia from coming, you can definitely have a natural birth. If let's say you have early sign of pre-eclampsia, deliver earlier, then you can still have induction. Because one Caesar, you can still induce, okay? Yes, Najiha, yes. Once baby come out, in most pre-eclampsia, it is very magical. Baby come out, blood pressure goes back to normal, everything normalized, so it's magical. So that's why we always think it has got to do with the placenta. But in very rare situation, it actually still happen after delivery, which is very, very rare. So cannot explain fully. Darren asks again, is it true that the earlier you have pre-eclampsia in your previous pregnancy, the higher the chance of recurring in the next pregnancy? Yes, because of you are put at higher risk, but you can still prevent, yeah? You can still prevent. Because I have mothers who have pre-eclampsia at very, very early stage. And because we start medication early in the next pregnancy, we totally prevent it. And for someone like you, Darren, I believe it's your wife, not you. We won't even bother to do pre-eclampsia screening test. We will just start you on aspirin straight the moment you're pregnant with high dose calcium. Yeah. Sukai asks, is pre-eclampsia causing the mother to swell? Yes, it is one of the causes for the mother to have a lot of water retention and a lot of swelling. Yeah. One of the things to remember in this topic is that pre-eclampsia can be screened. So we don't actually need to wait until we have one pre-eclampsia to be able to prevent the next one. Ideally, all women should have a pre-eclampsia screening test at 11 to 13 weeks to determine whether your risk of pre-eclampsia is high or not. And once it's determined that it's high, all women can start on treatment, which is aspirin and high-dose calcium, right from the start until towards the end of the pregnancy. Okay, so that's all for today. And any more things you want me to talk about, please put in the comment section. Yeah, anything you want me to discuss over the next few weeks, please put it in the comment section. So that's all for now. Thank you and bye-bye.